a short introduction into the fascial work at the lumbar area. There's one fascia coming from the buttocks, moving diagonal to latissimus dorsi and then going into the arm area. This is commonly connected to lower back pain. For some people, this cold feeling along the kidneys. And for people who tend to crack their lower thoracical spine. Sometimes the back area of the heart. To find an intro, we work with a proximal tension between the shoulder blade and the upper pelvis. According to the breath of the client, supporting length between my hands. Especially clients with chronic pain, you can easily feel the connection like a rubber band between your hands, so that the moment you bring weight to one side, you feel the gaining tension on the other hand. The more flexible, the more fluid and healthy the body is, the less you can feel this gaining tension in between. Slowly walking closer with the hands towards the raised area, we can work three-dimensional. With the upper hand and the lower hand as well. So you might even see the movement within the skin and within the shirt. The same movement is happening towards the fascia, thoracolumbalis. And in Nora, I can feel this reciprocal tension here. So I keep up this tension and start moving at the end of the elasticity. The more pressure I can use, the firmer the tissues, the higher I lift my body above. To work more specifically on the whole fascia going to the front, so-called linea alba, or the rectus muscle, the center of the rectus muscle, we can glue our hands along the waist, middle finger between the lowest rib and the pelvis, adjusting and gently leaning back till there's no more elasticity within the skin, and without pressure on the spine, just glued with the finger tips, upper fingers. We start working here with an intermediate pull. It's important not to release the pull and move like this. That's not really working at the fascia, but rather on the skin and the layers between fascia and skin. And then the movement is not as harmonious for Nora's body as well. So I try to really glue and work at this border of what her tissue can release towards her spine. So I work more on the belly area of the fascia, and a part of her spine where it's good to get a bit of skin credit. So I give a slight pull to the other side. Glue this time the heel of my palm close to her spine and work into the opposite direction with a slight push. Now, the almost tendon-like area of the fascia, very close to the spine, gets more impulse. This usually, especially throughout this intermediate movement, increases proprioception and so her awareness about this area as well. And this little rocking helps to release the joints between each vertebra.